Everybody has ADHD nowadays. Really? So the reason that people say this is because it seems like every day somebody else is coming out and saying, I have ADHD, I have ADHD, I think I have ADHD. There's a few different factors. One, we're starting to understand ADHD a lot better. Two, we're starting to understand how it presents in people differently. And three, there's a lot more awareness of ADHD out there in the world thanks to social media, TikTok, some of it good, some of it not so good. That's okay. There are statistics that run from 2 to 4% of the population has ADHD to 8, maybe 10%. And there are some studies or some opinions out there that say it can even be 20 to 25% of the population. So when you look at it through that lens, and you look at it with the understanding of before we thought it was like 2 to 4% of the population, and then all of a sudden we go to 8 or 10 or even 20, wow, that's a big jump, that's a big change. And a lot of it is because how ADHD is seen and understood in the wider world is still very misunderstood. As I stated in a previous video, there are 3 types of ADHD. There's inattentive, there's hyperactive impulsive, and then there's combined, which is what I have. However, within that, there's also the genderization of ADHD. For the longest time, we thought ADHD was very much predominantly a boys' disorder. So that's why proportionally you would see boys or men that would be diagnosed with ADHD way to proportion with women. And part of that is because the reason that ADHD is diagnosed in children is typically through the school because of behavioral issues or learning issues. And so boys are more likely to be loud or physically hyperactive, kind of have those big emotions, so tend to be much more externally viewable. Whereas girls, who are really good at masking, and we'll get into that in a different video, is usually more internalized presentation. So they often will have depression, anxiety, self-doubt, things like that. They'll keep it to themselves, or they will push it down and they won't show the world. I really don't like the boy-girl presentation binary because I'm a guy. I identify as a man, and that's how I live my life. And yet, if you were to use that male-female binary of presentation, I would be considered probably under the female because I wasn't diagnosed until I was in my late 30s. And that was because my daughter got diagnosed, and we had a lot of the same characteristics. So I thought maybe I should probably get assessed. Turns out I have ADHD. I've always had ADHD, but I learned to cope with it somewhat successfully. And so this whole binary of boy presentation, girl presentation doesn't make sense because a lot of it is really because of socialization, of how the genders are socialized in our society. And that's a whole other topic, regardless of ADHD. My point is that if you are an adult who doesn't know if they have ADHD because you're like, well, I'm not hyperactive, I'm not bouncing off the walls, I'm not, fidgeting all the time, that can't be me, or I don't have big emotions. There are so many different ways that ADHD can be seen or be felt or be presented. So if you are not sure if you have ADHD, talk to a professional, talk to your doctor. You can ask for an assessment. You can talk to a therapist. If you're not sure that you have ADHD and you're not interested in getting an assessment, which is totally understandable, you can still reach out to a therapist and say, I would like to try and develop systems or routines to help manage my life. I don't want to get assessed. I don't want to go on medication. And hopefully they're a good fit and they're able to work with you on that. I have often worked with many clients around that. So if this is something that speaks to you, that you would like to know more about, or you want to learn more about ADHD in general, whether it applies to you or not, or have a conversation. I'm available, so please reach out and stay tuned and hit like and subscribe. Thanks.